Hi, I'm Amanda and I suffer from complex regional pain syndrome. I wanted to talk to you a little bit about the CDC guidelines, which are going to be adopted and go into effect with both the FDA and the VA in June. These guidelines are not good for the chronic pain community. They don't take our needs into account at all. I mean, right now, most chronic pain patients have a difficult time getting their medication as is. There's a lot of hoops and a lot of things that you have to do every month in order to keep getting pain medications that I don't think most people realize. I mean, every month you have to pee in a cup and show that you have the proper levels of medications in your bloodstream so that you don't have too much of your medication or too little. You have random monthly pill counts where the doctor calls you up and he's like, hey, come on, bring in your pills. And you have to count and show that you are taking your pills as directed. We cannot go to the ER. If you go to the ER, then you are off. Your pain management specialist cuts you off completely. If you use more than one pharmacy, you're cut off. If you go to more than one doctor, you're cut off. I mean, for people that use these medications responsibly, we jump through a lot of hoops. And only 5% of chronic pain patients abuse their medications as a result. And yet 80 to 90% of chronic pain patients are going to be losing their medications if these guidelines go through. The CDC guidelines would limit opioid therapies to only terminal cancer and to end of life care. So unless you have those, you're screwed. I mean, anybody with peripheral neuropathy, with diabetic neuropathy, with complex regional pain syndrome, like I have, with fibromyalgia, MS, lupus, Lyme disease. I mean, there's a host of people that are going to be losing our medications. We're going to be left with two options. First option is go to the street, get illegal drugs, get the heroin and the meth, and risk our lives trying to control our pain. Or we can kill ourselves, and that is an equally viable option when you're in this much pain and there is absolutely no hope. I mean, most of us are lacking hope to begin with. And then to hear that our medications are going to be taken away, it's terrifying. And it's not terrifying because I'm looking for a fix, because I'm not. I don't take my medications to get high. I don't get high off my medications. Most patients don't get high off their medications. I mean, yes, we take high doses, but we take high doses every day. And your body just doesn't react the same. It's you become physically dependent. That's what it is. You become physically dependent, just like a diabetic becomes physically dependent on insulin, just like somebody with depression becomes physically dependent on antidepressants. I mean, it's physical dependence. That's what it is. It's not addiction. We are not drug addicts. We are chronic pain patients. And we deserve dignity. We deserve treatment. We deserve to be treated like people. I mean, right now, most chronic pain patients are looked at with skepticism and hostility. I mean, when people hear that you are a chronic pain patient, you're automatically judged. They think you're a drug addict. And and there's nothing you can do to convince them otherwise. If you say you're not, then they're like, well, then get off your meds. And you can't. And if you do go off your meds, you go into withdrawal because that's what your body does, just like it does with a heart medication or just like it does with an antidepressant. You go into withdrawals, and then they're like, well, you went into withdrawals, you must be an addict. But that's just not true. That's not how it works. And anybody who believes that needs to go back to school, especially doctors. You need to learn the difference. I mean, it's sad when chronic pain patients know more about conditions and diseases and effects of medication than most doctors. I mean, yes, doctors need more education. They do. We want them to have more education. We want some of the things that the CDC is giving, but they're taking more than they're giving. It's not at all taking into account the needs of the chronic pain community. The CDC is there to deal with epidemics, and they look at addiction as an epidemic. They don't look at chronic pain. To them, they are dealing with an epidemic, and they could care less about the effects otherwise. As long as they get their epidemic under control, then they don't care. And the reality is they're going to have to deal with an entirely new epidemic. They're going to have to deal with mass suicides. They're going to have to deal with more illegal drug use. They're going to have to deal with more overdoses from heroin. I mean, there's a lot of unintended consequences of these regulations that they haven't even thought of. And they don't care. They haven't asked our opinion. When they ask our opinion, they hear us talking, but they don't listen to what we're saying. They don't care what we're saying. And they've proved it time and time again. And we're sick of it. We're saying no. Hell no. We are not giving up our medications. You can try to take them, but we're not ready to give them up yet. And it's not because we're addicts. We're not addicts. It's because we deserve to be treated with the same dignity and respect as any other medical patient. If I had cancer, you would give me chemo. But I have chronic pain, my nerves don't function right, and that is not my fault. I am a medical patient, not a drug addict. I deserve dignity.